We took a break between part 1 and part 2, but I'm going to go over part 2 of Quizlet for exam 1, and this is for the read-write people or for anybody that wants to, look at the Quizlet. I think it's a great resource for you, and what I would encourage you to do from this day going forward is after every lecture, go in and do the Quizlets. And even do them before the lecture. You listen to the lecture, do the Quizlets that go with the lecture, and then do the activities in class, and that will just really help. We've kind of changed things a little bit because the NCLEX is a total application exam now. So it's all about applying. So that's why we have active activities. I give you lectures during tutoring and provide you with some information during like little sessions like this, okay? So let's go into like the second half of the Quizlet, and I'm going to start with the neuromedications and work my way up. Okay, so mannitol is going to be highly tested, and I think it could probably, obviously, turn up on your proctor. So it's an osmotic diuretic. It's for people at risk with increased intracranial pressure. It could also be used for increased intraocular pressure, but I think you're probably going to be tested mostly on it being used to decrease increased intracranial pressure. A lot of nursing implications for mannitol. The reason is it can cause pulmonary edema. So that's what you're going to be assessing for after somebody has a mannitol infusion or somebody's on a mannitol infusion, okay? You want to give it slowly, especially for that reason, because you need time to assess for the signs and symptoms of pulmonary edema, so you don't want to run it too quickly, okay? So I think pink frothy sputum, an ability to lie flat, and crackles are signs of mannitol, or I should say pulmonary edema. Furosemide is often given together, and I know you know that you give diuretics in the morning. Sometimes, though, I have to tell you, patients are critically ill. You may be giving these medications around the clock, right? Because you got to get that fluid off the brain. Okay, they need daily weights. You're going to check potassiums for anybody on furosemide. Now with phenytonin, this is used to prevent seizures because anybody with all the conditions we talked about, TBI, stroke, brain tumors, they could be at risk, the bleeds, they could be at risk for seizures. So they're going to be on phenytonin. So with phenytonin, remember, they could be hairy, they could have enlarged gums, so they need to see their dentist every 3 to 6 months. They could have nystagmus, which is the involuntary eye movements. They could get rashes, shouldn't take with pregnancy. The other thing with phenytonin, they should take it at the same time every day. They can't drink alcohol. They need to monitor blood levels. The normal is 10 to 20. So we like to see it between 10 to 20 to know that it's like in that therapeutic range. People need to use backup birth control, and they should take with food at the same time. Okay, and weight gain. Okay, so if somebody has weight gain, this is important. It may increase the incidence of seizures because the dose is weight dependent. So if I'm on phenytonin and I gain a lot of weight, I may start having seizures if I don't notify my provider and get my dose adjusted. And then if they lose a lot of weight, then they can get somnolent. Okay, so what I'm trying to say is if you have any weight changes, the patient needs to call the provider and get the dose adjusted. Yes, patients are at risk. Now, the other meds that I'm going to talk about are within the Quizlets, and I may have already talked about some in the first, but I'll be talking about more medications you'll need to know. So meningitis. Now, meningitis can occur from most of the conditions we talk about for exam 1, so you really got to know the crap out of meningitis. All right, so you did a case study in class, so I want you to go back and look at it because that's going to help you piece together how this looks in practice, okay? So people that are at risk, obviously, if you have an open traumatic brain injury, if you have an ear infection, because the ear is really near the brain, and I have a drain in my ear, so I'm at risk for meningitis. I had a friend that had a abscess on one of her back teeth. She's really busy, she's working double, she's trying to make ends meet, And one day we were in the PACU and she started getting confused. I'm like, ooh, what's wrong with her? She went for a CAT scan and she had meningitis because of the proximity of the teeth to the brain. That's kind of interesting, huh? So anybody with any kind of drain in their head, like if they're in the neuro ICU and they have a ventricular drain, or people after neurosurgery, or people with brain tumors, or people with a TBI may develop what's called hydrocephalus. So they get this VP shunt insertion, and that's going to put them at risk. Now, a VP shunt looks like this, okay? And it's used to treat excess fluid in the ventricles. So one end goes in the ventricles, and this is a surgical procedure. And then this is all inside the body. So there's no like outside drain is what I'm trying to say. And then it just flows into the peritoneal cavity to like redistribute the fluid so the patient won't have hydrocephalus anymore. But that's going to put them in at risk for meningitis. So the symptoms of meningitis are going to be seizures, a high temperature because it's an infection. They're going to have impaired cognition, so confusion, irritability. They'll be tired. They'll have a headache, altered mental status, maybe aphasia. Remember aphasia, what that means. Can't talk or you can't understand talking. Photophobia, so that means dim the lights in the room. Projectile vomiting. Petechiae if it's bacterial. So that means a petechial rash, so they'll have a rash. Emesis, so that means projectile vomiting. Nuchal rigidity and nystagmus. Now, nuchal rigidity is neck stiffness, and nystagmus is involuntary movements of the eyes. They're going to be sensitive to sounds. They could have tachycardia, and this is a posturing that Pistostonus. Don't worry about that. Okay, what are the classic signs of meningitis? Fever, neck stiffness, which is nuchal rigidity, a change in the LOC, and rash if it's meningococcal. Now, there's two meningeal signs you're going to need to know, and you'll need to know them from pediatrics as well, is Brudzinski sign and Kernig sign. So Brudzinski sign is severe neck stiffness caused by the patient's hips and knees to flex when the neck is flexed, okay? So this is a meningeal sign. So that's a sign you need to know. And then Kernig's, how I remember this is they can't straighten their knee, okay, when the leg is elevated. So here's what it looks like, Kernig sign. All right, so that's an important thing for you to know. Nursing implications, if you think somebody has meningitis, you put them on droplet precautions, put them in a private room, seizure precautions, and prevent and treat increased intracranial pressure. So again, preventing increased intracranial pressure, they need a stool softener, a dark, quiet room. You need to be on fevers and get them down quickly. Avoid hip and neck flexion, no bending. Monitor for shock, no coughing or sneezing. Head of bed, 30, neck and head in proper alignment or in a neutral position. Keep the room dark. Do not cluster care, so schedule the repositioning, the ADLs with the UAP. Give antibiotics. Antibiotics are going to be your priority if somebody has bacterial meningitis because it's what's going to stop it, okay? So the antibiotics get ready. So if you send cultures and then start them on antibiotics right away. All right, how is it treated? You got to monitor it, give the osmotic diuretics I talked about, possibly corticosteroids like methylprednisolone. Dexamethasone is also another good one for brain swelling. Antipyretics, don't let them get a temperature. Muscle relaxants. The first sign of increased intracranial pressure is a change in the LOC. Are you tired of me hearing that from me yet? Medications, phenytonin, acetaminophen, and the antibiotic administered as soon as possible. And it's diagnosed with the lumbar puncture, and I talked about that in an earlier Quizlet. Okay, it's important for you to know the nursing implications of that. All right, now I'm going to talk briefly about the Glasgow Coma Scale. Now, you're going to have one question about how do you calculate this. Now, I have another handout under your resources or your preparation, and it has like mnemonics that I use, and I also have a voice recording that goes with that. Okay, so you can go and check that out. And the important thing is for you to know right now is less than 8 intubate. That means that you need to be very worried about people that have Glasgow coma scales between 3 and 8. Okay, remember that the low end starts at 3. And there's also a quiz in your class about the Glasgow coma scale that you can just click on and go take and see how you do. Okay, now we're going to talk about brain tumors and craniotomies. So if somebody has somebody has a supratentorial, that means in the cerebrum, so it's above this tentorium. And if it's below the tentorium, we call that infratentorial. All right, so it's really important that there's like so many different types of brain tumors. So we're just going to keep it very high level, okay? Because you can't possibly memorize all the different signs and symptoms. So globally, most patients with brain tumors are going to complain of headaches when they wake up in the morning. Probably from lying flat, maybe increase intracranial pressure a little bit. They'll have an altered mental status, and some people present with seizures. Um, so that's important to know. Pituitary tumors, okay. We are going to talk about pituitary tumors for exam 2. Okay, so we'll worry about that a little bit later. But one thing I do want you to know is that anybody with a head injury or brain tumor or any kind of brain injury really is going to be at risk of what's called diabetes insipidus. And it has nothing to do with diabetes mellitus, although the patient is going to have polydipsia, which is increased thirst, and polyuria, which means copious amounts of the urine. So you're going to be looking for that in anybody with a head injury, brain tumor, some of the conditions we talked about, okay? So that means there's a lack of ADH. First sign of increase intracranial is your change in LOC. Hydrocephalus is treated with a VP shunt, and sometimes that happens, they get hydrocephalus after brain surgery or because the tumor is pressing on the area. Okay, so that's important to know. So the purpose of the VP shunt is to drain the cerebral spinal fluid from the ventricle of the brain to the peritoneal cavity. And it puts them at risk for infection and meningitis. The patient with DI is going to have an output greater than their input. So that's something you're going to look at. And the urine is described as copious and pale. So because they're putting out all this urine, you have to have them on daily weights, a strict I&O. Don't give them caffeine because caffeine is like a mild diuretic. Don't restrict fluids and monitor the specific gravity, which will be low, of the urine. We're going to talk about the pituitary tumors for the second exam, okay? So if somebody had a supratentorial craniotomy, you need to make sure the head of bed is 30. Head and neck need to be midline. And if they have an infratentorial, it's flat or 10 degrees. So that's important for you to know. All right, now I'm going to talk about the degenerate neuro disorders. Okay, the first one I'm going to talk about is Parkinson's disease, and it's caused by a lack of dopamine. And the triad of symptoms that you're going to see is a resting tremor, and it's usually in their hands. It's called a pill rolling tremor, and it's resting. So that means they're just sitting there and still tremoring, okay? Bradykinesia means slow movement, and they're going to have rigidity. And oftentimes it's described as cogwheel rigidity. And if you've ever taken care of somebody with Parkinson's, like if you're trying to dress them, they can kind of like pull back. If you're pulling their arm or something, that's like cogwheel rigidity. Okay. So the resting tremor will be on one side. They also have a mask like face. They have stooped posture and a shuffling gait with a lack of arm swing. Okay, so that's important to know. It puts them at risk for falls. So one thing you can do is tell them to walk like they're walking over a stack of books or some bricks, okay, because they got to lift their foot up. All right, the medications, make sure you know the medication classes. So you can remember the mnemonic salad. So um, Selegene is an MOAI, so we'll talk about that in a minute. Anticholinergics, levodopa and carbidopa, amanitin and dopa agonists. So that's important to know. What type of drug is selegiline? It is a monoamine oxidase inhibitor, which means they can't eat pickled, fermented, smoked meats, Chianti wine, alcohol, soybeans, processed meats, and aged hard cheddar cheese, like cheddar cheese. Okay, they can't have that. Okay, now we're going to move on to multiple sclerosis. And I'm just going to touch on a few things because you really only need to know a few things about these conditions. Okay, so the signs and symptoms. Now, the conditions I'm talking about, with the exception of Guillain-Barré, are all progressive neurological disorders, which means they're going to get worse over time. Okay. Now, with multiple sclerosis, while it's true it may get worse over time, people do have exacerbations and remissions. Okay. So that's important to know. So Watson are the signs and symptoms. So weakness, ataxia, and with them, they have an intention tremor, whereas Parkinson's has a resting tremor. So an intentional tremor is when you go to reach for something and the hand starts shaking. That's like an example. Speech, they're going to have problems with speech and dysphagia. So there'll be all these patients too that I'm going to be talking about here are going to be aspiration risk. Okay, so that's like some of the main interventions if they have symptoms of that. O is for optic neuritis. So many people with MS, usually young women, present with blind spots or double vision in their early 20s. Nystagmus, involuntary movements. Remember that. Alzheimer's, I know you had that in fundamentals. I'm not going to go into a lot of detail. Basically, I think most of your questions will be about keeping them safe from roaming and also like fall precautions and just taking care of somebody with dementia in general. Okay. ALS is amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. It is a degenerative disorder which always results in death. It's very sad. So there's no cure for it. And so, again, they're going to eventually have difficulty swallowing and speaking. They may get a trach and they may be put on mechanical ventilation, but they're going to eventually die. So they'll have hospice care. But your main, remember, preventing aspiration, I've already talked about that in another lecture. With Guillain-Barré syndrome, okay, it's an autoimmune condition that's triggered by some recent infection. So there's a few variations of NCLEX questions. Like you'll have like a college kid that gets a flu vaccine, or somebody comes in and they say they've had an upper respiratory infection a couple weeks ago. Okay, you got to start thinking of Guillain-Barré. Okay, so what happens in Guillain-Barré is they have an ascending paralysis, and which means it starts in the lower extremities and starts moving its way up the body. And so what you worry about is when it gets to the thighs and hips, it's going to go to the thorax next, and that means that their respiratory muscles aren't going to be working. So Guillain-Barré is actually you treat it symptomatically, right? So they may need mechanical ventilation for a short period of time, but usually they respond very well to the treatment and they return to normal function. So that's really all you have to know about that. With myasthenia gravis, they have descending weakness. Okay, so it starts at the top of the head. They're going to have double vision. Dysarthria means trouble speaking. And then dysphagia, dyspnea, and descending weakness. Okay, so again, you gotta protect their airway. Suction equipment needs to be hooked up, ready to go, and you're going to assess their ability to swallow. Okay, so that kind of shortens your lesson for that, but those are the important things that you need to know. Okay, so that gives you kind of an overview of Quizlet and how you can use it to your advantage. I hope you like this, and I just want to address that in your class, you will be doing all active strategies. I know a couple people have asked me about this. I teach in the last semester of the ADM program, the Med Surge, and it's all active. I have a 5 hour class and I don't lecture in the class. I do like review topics people want me to review. And if you want me to review anything for your tutoring, I'd be happy to do that. But I would say you should come to tutoring with already have listened to the lectures one time, looked at the material a little bit there, and you don't have to use the ones I provide. There are more traditional slides, PowerPoint slides, and there's a voiceover PowerPoint if you'd rather do that. Those are like longer lectures. They're more traditional. I like to make shorter lectures because research is showing us that the kids these days, which I mean you guys, they like shorter podcasts and shorter lectures. So, it's not so overwhelming. And I know that a lot of you are strapped for time. So I kind of take that into consideration. And I try to keep those lectures under 10 minutes. So if you feel like you can't sit down and study for 2 hours, you can certainly study for 10 minutes, right? And then I put the lectures on SoundCloud so that you can listen to them when you're driving in your car, walking your dog, and doing all those kind of things, okay? So just remember, spaced repetition is good. And I've done a lot of repetition in these lectures and on the lectures I have on SoundCloud, okay? So I want everybody to do well. So good luck on your first exam.